Good morning, ladies and gentlemen. The white coat ceremony will begin in about 5 minutes. Please take this time to find your seats and silence your cell phones. Thank you.
Welcome. Please be seated. My name is Dr. Thomas Skandalis, and it is my privilege to serve as the Dean of the College of Osteopathic Medicine. It is now my honor to introduce the platform party for today's white coat ceremony. I ask that they stand and remain standing as they are introduced. Michael Lawler, PhD, President, Pacific Northwest University of Health Sciences. Catherine Potts, MD, Chair of the Board of Trustees. Edward Bilski, PhD, Provost and Chief Academic Officer. Robert Sorrells, PhD, Associate Dean for Preclinical Education, and as of July 1st, Professor Emeritus. Emily Astrike, PhD, Assistant Dean for Preclinical Education, and as of July 1, Associate Dean of Preclinical Education. It's okay? It's good? It's good? Mina Ramos-Diaz, MD, Chief Diversity Officer. Elizabeth McMurtry, DO, Associate Dean for Clinical Education. And our Assistant Deans for Clinical Education, Marie Cadwell-Meyer, DO. Heather Phipps, DO. Brenda Polite, MD. Miko Rose, DO. PNW faculty and faculty coders. Veronica Hernandez, Lieutenant, United States Public Health Service. Dua Khan, third-year medical student and class of 2023 Student Government Association President. Our keynote speaker for today's ceremony, Kelly Noyes, DO. Please be seated. A brief, and I promise brief, history of the white coat. It may surprise you to learn that historically and up through the late 19th century, doctors actually didn't wear white at all. In fact, they only wore black. The black garments of the doctors of the past not only signified their somber, serious presence that, well, let's face it, was pretty much associated with death most of the time, but they also served the practical function of disguising dirty garments and all of the messy stains of medical practice at that time. As the medical profession advanced beyond bloodletting, and things like germs were discovered, the American Medical Association, describes how there was a push to remake how doctors appeared to the public. Enter the doctor's white coat. Out with that black look of death and in with a clean, sterile look. Hospitals made the switch to equipping their beds with fresh new white sheets. Nurses topped their nursing whites with white caps, and doctors donned new white coats meant to restore the public's trust in them and their new hand-washing skills. Sure, the black coat may have been a little more practical in terms of hiding stains or ushering a patient to the other side, but the white coat became an overarching symbol of the new face of medicine. It is clear that the white coat became synonymous with portraying the doctor as a respected authority in the new and improved medical field, and that image has never really left. And thus, the iconic doctor's white coat was born. Many patients find comfort in the symbol of the white coat for medical professionals, so it remains a central figure in patient-centered care. So the white coat will continue to live on, and it is now your responsibility for it and you to represent the best of the House of Medicine and the best of humanity. It is now my sincere pleasure to invite Dr. Michael Lawler to the podium.
Thank you, Dr. Skandalis. So welcome students, loved ones, to the PNW White Coat Ceremony. This is an important step in your professional development, your development of excellence toward becoming an osteopathic physician, respected professional healthcare provider. Students, being professional, being called a professional means you profess your values as a physician in the clinic and in our community. With the white coat, you signal to the world that you work for the greater good, you work for the well-being of others, and for the betterment of humanity. Others will look to you for guidance and leadership, and you will provide it with care and compassion. Living by your professional values has tremendous returns. You will gain the respect of others at work, in the general public, and amongst your loved ones. But most important, you will earn the honor of being a trusted healer. Becoming a physician is an intense learning process, and your learning will continue long after graduation. In fact, as our colleagues here know, learning continues long after graduation. In fact, the learning is lifelong and continuous, as a physician is always updating their skills, learning new approaches, and building new evidence for best practices. I congratulate you on this important step in your career, and I extend my sincere appreciation to your loved ones. Also, I thank the outstanding PNW faculty and staff for their deep commitment to developing you into physicians. Thank you, faculty and staff. Students, welcome to the clinical phase of your education. It is now my distinct pleasure to introduce the Chair of the Board of Trustees, Dr. Catherine Potts. Dr. Potts is a board-certified internist who practiced at Virginia Mason Hospital from 1993 until 2021, although I think she's still practicing in the year 2022. She had multiple leadership roles at Virginia Mason. Dr. Potts recently received the prestigious James Tate Mason Award, the highest honor for a physician at Virginia Mason Medical Center. Please join me in welcoming Dr. Catherine Potts.
Thank you, Dr. Lawler. On behalf of the Board of Trustees, it is my privilege to welcome you all to the White Coat Ceremony for the class of 2024. As you know, this ceremony marks the completion of 2 years of rigorous didactic studies and the beginning of your clinical rotations, a time during which you will truly feel that you've begun the practice of medicine. While the white coat originally started, as you've already heard, as a symbol of cleanliness in the 19th century, today it represents a commitment to a profession marked by compassion, trust, and lifelong learning. I speak from experience when I say that over the next 2 years, and in fact throughout your entire career in medicine, there will be times when you will be short of sleep, stressed, impatient, and feel that you just don't have anything more to give. That is a time to pause and remember how you felt today, putting on your white coat. Then take a deep breath and open your heart to your patients one more time. I know I speak for the entire Board of Trustees when I express how proud we are of what you have already accomplished and extend our best wishes for this next stage of your medical school education. Congratulations.
Thank you, Dr. Potts and Dr. Lawler. It's fantastic that we have such leadership here at PNWU. I'm Ed Bilski, the Provost and Chief Academic Officer, and I welcome you and good morning. Just 2 weeks ago, we were here celebrating the 10th graduating class of PNWU medical students as they transitioned to becoming osteopathic physicians. Just think in 2 years, less than 2 years, you'll be walking the stage doing the same thing. The newsfeed that morning mentioned 4 pieces of advice that all commencement speeches share. Essentially, it all boils down to these 4 elements: dreaming big, working hard, making mistakes and learning from those mistakes, and being kind. But this is a white coat ceremony, so as any good Google scholar would do, I searched for the core advice to give at a white coat ceremony. Pretty much failed miserably at that. But I'm still willing to learn, as I'm trying to learn DuckDuckGo, which, Dr. Skandalis, that's another search engine, in case you didn't know that. About as close as I could find was, how much should I give on a white coat ceremony gift? So, Dr. Skandalis, please get that credit card out there and get on your Amazon. You got a lot to appreciate about these students. On a serious note, you guys are experts on dreaming big, working hard, and being kind. And I do hope that all your biggest mistakes are behind you, thanking your patients and medical insurers, because that's obviously very important. But the pandemic has emphasized your adaptability, your resilience, and your willingness to put the health of the community and other individuals ahead of your own personal safety. Your courage and compassion will serve you as you enter into the clinical years of your profession. You are also keenly aware of the value of lifelong learning and the role mentors play in that process, whether they're the faculty that sit behind me, the staff, the coworkers that you'll have, colleagues, and your family and friends are all mentors. So I have just one request for you today, and that's to take that experience, that passion, and wherewithal, and commit to recruiting and mentoring others who may be sitting on the sidelines, not recognizing their own talents and abilities. We desperately need more leaders like yourselves for both the healthcare system and our society. So congratulations, class of 2024, and that's when you're graduating. You rock. And now it's a distinct honor to introduce the next speaker, Lieutenant Veronica Hernandez. She is with the United States Public Health Service and will be presenting a special presentation. Lieutenant Hernandez?
Thank you, Dr. Bilski. I am here today on behalf of the Surgeon General of the United States to recognize an outstanding student who has been selected to receive the 2022 Excellence in Public Health Award. The Public Health Service was founded in 1798 to provide medical care to sailors and merchant seamen with yellow fever and malaria. Over the subsequent 220 years, our mission has brought in to deliver health, promotion, and disease prevention programs to all people. Today, the Commission Corps of the Public Health Service is dedicated to serving the front lines in the nation's fight against disease and poor health conditions. On behalf of the U.S. Public Health Service, I would like to recognize Finian Moon with the 2022 Excellence in Public Health Award. Her Her leadership Her leadership, particularly around issues of professional wellness and its impact on health services, is appreciated. Thank you for your hard work and dedication to the public health, and we hope you consider a career in the U.S. Public Health Service. Finian, please come on stage and receive your certificate.
Thank you, Lieutenant Hernandez, and congratulations, Finian. She didn't know that she was going to receive this award until just now. I would now like to introduce and welcome Dua Khan, third-year medical student, to share an inspirational thought. Dua is the Class of 2023 Student Government Association President. Dua?
Dolly Parton once said, "If you want the rainbow, you gotta put up with the rain." I think it is safe to say your class has put up with not just rain, but a monsoon these past 2 years. Medical school is challenging as it is, but to be a medical student through the heat of the pandemic is no small feat. From learning much of your preclinical education online, to endless Zoom meetings, to social distancing from your own family, friends, and peers, you have put up with the most tiring circumstances, and yet you have still prevailed. While the monsoon season has dissipated, you still experience rain. The challenges are still there: endless exams, rotations, and grueling schedules. However, what you have endured these past 2 years has made you resilient, like no other class before you. You are going to be strong physicians because you have faced adversity head on. You've adapted to new ways of learning and found how to persevere through a pandemic. Remember these skills. They are going to advance you in your future career as physicians. Remember the people who have supported you on this journey. They will continue to cheer you on in your journey. Remember the friends you have made sitting next to you. At first, they were 6 feet apart, and soon you will be spread out even further all around the Pacific Northwest. In the end, no matter where you go, remember these people and these memories. You continue to be lifelong learners and have taken the responsibility to serve your communities. The white coat you are wearing today, or will be wearing, symbolizes the start of your journey to find your own rainbow. Congratulations on making it this far in your medical school career. All your loved ones, support systems, and the school look forward to seeing your rainbows shine as you proceed in your journey. Now, it is my pleasure to introduce Maxwell Finch, Class of 2024 Student Government Association President, to present the class vision statement. Maxwell, please join me on stage.
Thank you, Dua. Welcome, PNWU family and friends. My name is Maxwell Finch, and I'm the Class of 2024 Student Government President. It is an honor to be here as a last-minute replacement for student Dr. Swell, who won't be able to join us for another 3 to 4 weeks until his beard grows back. For those who know me, you are probably aware that speaking in front of large audiences is far from the top of the list regarding favorite aspects of my role. However, in this role, I have had the opportunity to work with exceptional peers who continue to pave the way for a brighter future in healthcare. It turns out, as Dua said, medical school is in fact hard, and we got to do it during a global pandemic. As we work towards becoming quality physicians, we also face public health issues, including improving mental health, advocating for women's rights, and closing the gap on healthcare disparities for people of color. These topics will shape our country for decades to come, and we are the voices that our communities will follow. I believe that we must use our voices with determination and with care for those in need. Now, for the past 2 years, I've worked with many of you, ranging from do I really need to be called on in a CIL, to can we please have more NIH funding so I can actually go to residency? Throughout these 2 years, I can say with confidence that the humanism, grit, and character of our class will help guide each of us on your own journey in healthcare and will help thousands of future patients to come. During this time, it has been an honor to work beside each of you. Thank you all for allowing me to be here, and to my classmates for allowing me to manipulate your votes for every major SGA election to continue to represent you both as a leader, but also as a friend. As I conclude, I will now share the Class of 2024 vision statement. In our practice of mastery, the PNWU Class of 2024 strives for professional excellence, engages in collaborative healthcare, and advocates for diversity, equity, and inclusion. To better our future patients and communities, we are committed to being the change we wish to see in this world and remaining curious and compassionate as leaders in osteopathic medicine. Thank you all.
Thank you, Dua and Maxwell. I would like to take a moment to recognize some special individuals. May I please have the parents, grandparents, spouses, significant others, and family members of our medical students to please stand. Thank you for the sacrifices many of you have made and will continue to make in helping your medical student achieve great success. Your support is so very important. Thank you. Our Board of Trustees, faculty, faculty coders, staff, and university administration, please stand. As you can see from all those standing that it takes many to educate a physician. I thank each one of you for your commitment and dedication. I also thank all of you here today who have supported our mission and helped the university to grow and to thrive. Please be seated. We gather here today to honor the class of 2024. This class has an exceptional educational background and, more importantly, are exceptional individuals. A biblical quote, "From everyone to whom much has been given, much will be required. And from the one to whom much has been entrusted, even more will be demanded." The next 4 years will prove to be a challenge that will be successfully met by the class of 2024. At this time, it gives me great pleasure to introduce our guest speaker today, Kelly Noyes, DO. Dr. Noyes was raised in Enumclaw, Washington. It took me a couple tries to say that correctly. Did I get it right, Dr. Noyes? Close? I'm from New York. What do I know about Enumclaw? She completed her undergraduate biology degree at Central Washington University in Ellensburg, Washington. She attended PNWU College of Osteopathic Medicine as part of the school's first class. While attending PNWU, she spent her 3rd and 4th years in Billings, Montana, and graduated with the inaugural class in 2020. When did you graduate? 2012. It's 8 plus 4 is 12. She then completed internal medicine residency training in Sierra Vista, Arizona. Dr. Noyes returned to Washington, where she worked in an internal medicine clinic and as a hospitalist in Ellensburg. While in Ellensburg, she began teaching 3rd and 4th year medical students and caught the teaching bug. And in September of last fall, transitioned to full-time faculty as an assistant professor of internal medicine at PNWU. In her free time, Dr. Noyes enjoys spending time at home with her husband, Cody, where they raise livestock and train horses. That helps her to train medical students. Dr. Noyes, please come to the podium.
Thank you so much for the introduction. I am honored to be here today. I've been deeply humbled with the opportunity to speak to you, the class of 2024, at such a momentous occasion. I similarly sat in your position, anxiously waiting my white coat. I do not remember our white coats speaker's address very well, but I remember being surrounded by family and friends who supported me along the way. I recall thinking how much has been done to prepare me for this moment. Looking back, I had no idea how much there was to go. At the time, PNWU presented white coats at the beginning of medical school. With the transition of this ceremony to the end of second year, as the students are about to embark on clinical rotations, they begin the transition from the study of medicine to the practice of medicine. Donning white coats today will symbolize this transition. Before I get ahead of myself, we need to stop. For the last year, the students have heard me repeatedly stop them while trying to read clinical vignettes during my interactive lectures. In an effort to prepare them for board exams, I would present a complicated clinical case, and as they would start reading the case, I would interrupt them with this really obnoxious picture. Yeah. By reading the question and the possible answer choices first, it prepared them to answer the clinical vignette better, to know what things to look for in the vignette to get them to the right answer. As the year went on, we answered less and less multiple choice questions, and we started answering more open-ended questions. So before we talk through the situation the class of 2024 is about to embark upon, we need to start with the question. What kind of physician do you want to be? The multiple choice options that may come to mind are A, family medicine physician, B, internal medicine physician, C, emergency medicine physician, a multitude of answers. It's one set of answers that will be presented to you, and hopefully with exposure to different rotations in the next 2 years, each student will be able to answer confidently. Today's question is not a multiple choice question. Today's question is an open-ended question. At the beginning of medical school, the students were asked to complete a professional identity development plan. One of the questions asked was to identify 10 characteristics you have observed in exemplary physicians that you wish to emulate. Do you guys remember filling those questions out long ago? Yeah. The answers were nearly identical from all of the students. They're probably the same characteristics that we all conjure in our minds when we think about what kind of doctor we want taking care of us or our loved ones. In April, the first graduating class at Pacific Northwest University returned to campus for our 10-year reunion. My classmates and now colleagues, who are some of those exemplary physicians that you described, their answers were no different. The characteristics are those that separate the science of medicine from the art of medicine. Not just what makes a physician, but what makes a good physician. No one answered be the smartest in the room, or see as many patients as possible in a day, or drive a nice car. Everyone wants the physician who listens well and communicates clearly, who is empathetic and compassionate. They want a physician who works collaboratively with other members on their team, who is passionate about their chosen field. The good physician is both knowledgeable, but also willing to learn new things, with the highest level of trust and integrity. As you start rotations, you will get to meet many physicians. One physician sticks out in my mind as an example of a good physician. I was lucky enough to be mentored by Dr. Sansaran Patel as a fourth-year medical student, and then later as an intern and resident. Dr. Patel practiced internal medicine in Arizona in a solo physician practice, while also attending to his own patients in the hospital 24/7. Despite his grueling schedule, he showed up every day with a positive attitude, ready to care for his patients. He always sat with his patients, holding their hand, actively listening. He met each patient where they were, supporting them during their triumphs and during their illnesses. He was informed and always learning new things. He was approachable and respected by patients, colleagues, and the community. As you start rotations, know that not all physicians you work with will have these characteristics. Search out those that do. So now that we know what the question is, what kind of physician do you want to be, and the ideal answers, those characteristics that make a physician a good physician, let's go back to the vignette. You're a soon-to-be third-year medical student with a past history of undergraduate studies, MCAT scores, and 2 years of medical school behind you in a pandemic. You have hopefully passed COMLEX Level 1. I know, sorry to bring it up. On physical exam, you're nervously awaiting the start of the next chapter of your journey in medical education, clinical rotations. When you get up early in the morning and head out the door, as you enter the clinic or hospital for your day and you put on your white coat, ask yourself the question, what kind of physician do I want to be? As you put on your white coat, know that you're also putting on the expectations of your patients. They're divulging their personal information, their hopes for their health, their fears of their illness, to a person sitting in a white coat next to them, hoping they emulate those exemplary characteristics you all described. Think about physicians like Dr. Patel and the mentors you will find along the way. Do not don the white coat of authority, but put on the white coat of listening, empathy, teamwork, passion, competence, with a willingness to learn, and trustworthiness. Congratulations on this accomplishment and taking the next step in becoming not just a physician, but a good physician. Thank you.
I don't have a copy of a slide here, so Dr. Noyes, thank you so much for speaking today and for those words of wisdom. And it is an honor to present with you this crystal apple as a token of our appreciation. It is now time to invite the class of 2024 to the stage to receive their white coats. Boy, are they anxious to receive their white coats. Following the coating, they will recite the ceremonial oath.
Good afternoon, I'm a coder. My name is Dr. Amy Solomon. I am R.A. Solomon's mommy. I'm a faculty physician at Montana Family Medicine Residency, and we see a lot of PNWU students come through in their 3rd and 4th years.
R.A. Solomon, Santa Cruz, California, and I went to school at Colorado School of Mines.
Ria Sarah Yalamanchili from Falmouth, Maine, and went to Cornell University.
Maxwell Finch, Bellingham, Washington, UC Santa Cruz.
Finian Moon, Corbett, Oregon, Simon Fraser University.
Aman Qureshi, Chatham, England, Clark University.
Chad Kane, Bonnie Lake, Washington, Pacific Lutheran University.
Turan Ketene, Seattle, Washington, University of Washington.
Cameron Park from Anderson, South Carolina, Brigham Young University, Idaho.
Kyle Meelan, Seattle, Washington, Western Washington University.
Ana Caudillo, Juarez, Chihuahua, University of Denver.
Katia Knignitska, Tri-Cities, Washington, Washington State University.
Parker Dean, Federal Way, Washington, University of Washington.
Joseph Lloyd, Houston, Texas, Baylor University.
Claire Berner, Warren, Oregon, Occidental College.
Dan Bricey, Glenarm, Maryland, James Madison University.
Akash Sharma, Surrey, British Columbia, University of British Columbia.
Andrew Stoll, Portland, Oregon, Oregon State University.
Kirsten Tucker, Spokane, Washington, University of Montana.
I'm Dr. McMurtry. I'm the Associate Dean for Clinical Education, and I'm your next coder.
Joshua Christensen, Foreman, North Dakota, University of North Dakota.
Ellie Cook, San Diego, California, Willamette University.
Nicole Minerath, Alexandria, Minnesota, University of Minnesota.
Michael Storch, Stevens Point, Wisconsin, University of Wisconsin-Madison.
Callie Cruson, Bend, Oregon, Eastern Oregon University.
Trevor Haverkamp, Vancouver, Washington, Western Washington University.
Ratka Galiot, Milwaukee, Wisconsin, University of Wisconsin-Milwaukee.
Priya McBride, Hoquiam, Washington, Pacific Lutheran University.
Ekaterina Birolava, Dushanbe, Tajikistan, Washington State University.
Hi, I'm Robert Charles. I'll be the next coder, and this is supposed to be the easy part.
Suman Panwar, Bellingham, Washington, Western Washington University.
Gayane Adamyan, Los Angeles, California, UCLA.
Carla Sainz Reyes, San Diego, California, San Diego State University.
Andrea Farias Gonzalez, San Diego, California, University of California, San Diego.
Evan Taylor, Charleston, Utah, University of Utah.
Felipe Castañeda, Idaho Falls, Idaho, Utah State University.
Jacob Nilsson, Eden, Utah, Weber State University.
Colton Preet, Fort Macleod, Alberta, Canada, Brigham Young University.
Keaton Duty, Atlanta, Georgia, Brigham Young University.
I'm Mark Baldwin, internal medicine.
Paul Amarino, Banner Oak, North Carolina, Lees McRae College.
Chiang Shoulders, Sacramento, California, University of California, Davis.
Christy Wang, Tucson, Arizona, University of Arizona.
Kent Charrington, Sugar City, Idaho, Brigham Young University, Idaho.
Joan Solis, Kennewick, Washington, University of Washington.
Josh Bailey, Portland, Oregon, Brigham Young University.
Jason Ritchie, Alpine, Utah, Utah Valley University.
Marie Cadwell-Meyer, Family Medicine, PNWU alum.
Tim Holmes, Salt Lake City, Utah, Utah Valley University.
Daniel Human, Newbury Park, California, California State University, Chico.
Genevieve Sarwick, Oakland, California, Denison University.
Joseph Walters, Buffalo, Wyoming, Montana State University, Billings.
Caitlin Martin, Fullerton, California, Boise State University.
Kelsey Shea, San Anselmo, California, University of California, Berkeley.
Geneva Stewart, Portland, Oregon, University of Montana.
Sandra Kibble, Clio, California, Oberlin College and University.
Charles Lee, Portland, Oregon, Santa Clara University.
I'm Tom Gohl, Department of Family Medicine, PNWU.
I'm Nathan Lungstrom, Spokane, Washington, University of Washington.
Alex Brandt, Issaquah, Washington, University of Washington. Shout out to Mom and Dad. Thank you so much.
Elena Petrick, Federal A, Washington, Pacific Lutheran University.
Shannon Bulliard, Andrew, North Carolina, East Carolina University.
Madeline Haggart, San Diego, California, and the University of Washington.
Nick Kirkus, Spokane, Washington, Whitworth University.
Jamie Steach, Pasco, Washington, Pacific University.
Rashay Sharma, Kennewick, Washington, Washington State University.
Olivia Beck, Palmer, Alaska, University of Redlands.
Catherine Huden, Pediatrics.
Molly Anderson, Circle Pines, Minnesota, St. Catherine University.
Lainey Lobby, Seattle, Washington, Claremont McKenna College.
Hannah Ray Kirk, Craig, Colorado, Oregon State University.
Peyton Bjorkman, Ellsworth, Wisconsin, University of Wisconsin-La Crosse.
Sadie Walter, Oceanside, California, Oregon State University.
Elizabeth Habicht, Anchorage, Alaska, Willamette University.
McKenna Smith, Rifle, Colorado, Willamette University.
Kennedy Fugelseth, Fertile, Minnesota, University of North Dakota.
Elliot Deering, Duval, Washington, University of Washington.
Crystal Martin, Department of Osteopathic Principles and Practices.
Steve Sorensen, Richland, Washington, Brigham Young University.
Casey Quinn, Cle Elum, Washington, the Montana State University.
Larissa Fisher, Sauk Center, Minnesota, Montana State University.
Jessica Bailey, Spearfish, South Dakota, University of Montana.
Jocelyn Larson, Yakima, Washington, Washington State University.
Cheyenne Ron, Roseburg, Oregon, Portland State University.
Alexa Navarro, Spokane, Washington, Eastern Washington University.
Jordan Fieser, Southeast Portland, University of Nebraska, Omaha.
Jim Katslamidas, Pocatello, Idaho, Montana State University.
Jeff Novak, Department of Biomedical Sciences.
Dane Warp, Havre, Montana, Carroll College.
Hamza Amini, San Diego, California, San Diego State University.
Justin Taylor, Portland, Oregon, Concordia University, Portland.
Ian Van Bramer, Federal Way, Washington, Gonzaga University.
Chikuma Timothy Woha, Seattle, Washington, University of Washington.
Raymond D. Padula, Silverdale, Washington, Washington State University.
Francis Gadreas, Tucson, Arizona, Arizona State University.
Caitlin Kaluzny, Yakima, Washington, Arizona State University.
Samit Kaur Ajla, Auburn, Washington, Washington State University.
Heather Phipps, Assistant Dean for Clinical Education and Orthopedic Surgeon.
Shakri Salad, SeaTac, Washington, University of Washington.
Kate Wabema, Elk Grove, California, University of Portland.
Macrina Camel, Portland, Oregon, Portland State University.
Karen Wong, Fresno, California, California State University, Fresno.
Sean Kim, Seattle, Washington, Emory University.
William Ray, Kwajalein, Marshall Islands, Central Washington University.
Victoria McPherson, Bellevue, Washington, University of Washington.
Harsuk Theol, Marysville, Washington, University of Washington.
Maxie Revis, Buckley, Washington, and Central Washington University.
Brenda Polite, Assistant Dean for Clinical Education.
Likat Lahaj Musa, Ranch Cucamonga, California. Almost fell, sorry. UCLA. Kayla Cribben, Puyallup, Washington, Washington State University.
Sage Sorensen, Ukiah, California, University of California, Merced.
Khushbu Singh, Hayward, California, University of California, Merced.
Marissa Krager, Clackamas, Oregon, Linfield College School of Nursing.
Meredith McDermott, Portland, Oregon, Central Washington University.
James Bonaparte, Portland, Oregon, University of Oregon.
Nicholas Ragland, Kingston, Washington, Central Washington University.
Riley Oakes, Anacortes, Washington, Western Washington University.
Julie Habecker, Biomedical Sciences.
Jarl Theisel, Yakima, Washington, University of Washington.
Kelly Kammermeyer, Falls Church, Virginia, University of Washington.
Lauren Kirk, Atlanta, Georgia, University of Washington.
Madeline Green, Wilsonville, Oregon, Humboldt State University.
Breland Smith, Vicksburg, Mississippi, University of Texas, San Antonio.
Andrea Negrete, Torrance, California, Seattle Pacific University.
Sam Crompton, Lakeside, Montana, Pacific Lutheran University.
Lindsay Eaton, Kent, Washington, University of Washington.
Alex Broyles, Yakima, Washington, Carroll College.
Diana Rhodes, Department of Anatomy.
Nikolai Livshaz, Bellevue, Washington, Whitman College.
Jonathan Brown, Gig Harbor, Washington, the Masters University.
Ashley King, Roseburg, Oregon, Oregon State University.
Charlotte Graham, Mercer Island, Washington, Whitman College.
Fernando Vázquez, Tecomán, Colima, Eastern Washington University.
Brandon Perry, Yakima, Washington, Central Washington University.
Elizabeth Jans, Cooper, Maine, University of Maine at Machias.
Kelly Ingram, Idaho Falls, Idaho, University of Utah.
Ryan Volker, Wapato, Washington, Washington State University.
Mika Rose, Assistant Dean for Clinical Education, Psychiatry.
Jennifer Wong, Beaverton, Oregon, Pacific University.
Montana Hawksford, Shoreline, Washington, University of Washington.
Rebecca Baker, Cloverdale, California, University of California, Davis.
Andrew Widman, Bellingham, Washington, Western Washington University.
Gracie Struble, Idaho Falls, Idaho, Regis University.
Patrick Huang, Ho Chi Minh City, Vietnam, and UCLA.
Rohan Hassan, Sammamish, Washington, University of Washington, Seattle.
Anna Lee, Ocala, Florida, University of Miami.
Tiffany Ho, Honolulu, Hawaii, UC San Diego.
Jean Rupert, Assistant Dean for Clinical Education and Family Medicine.
Melvin Tan, Seattle, Washington, the University of Arkansas.
Ari Akavan, Sunland, California, California State University, Northridge.
Angie Youssef, San Diego, California, University of California, Irvine.
Fadila Nurullah, Lacey, Washington, University of Washington, Bothell.
Stacy Maynard, Great Falls, Montana, University of Puget Sound.
Chris Rasky, Orlando, Florida, BYU Provo.
Adam Scalini, Corvallis, Oregon, Oregon State University.
Congratulations, class of 2024. Student doctors, please rise and join me in the reciting the ceremonial oath located in the back of your program. Please recite after me. As I continue the study of medicine at Pacific Northwest University of Health Sciences, College of Osteopathic Medicine, okay, shorter sentences. I will enter into a relationship of mutual respect with my teachers. And my colleagues to enhance the learning patient care environment. And gain the knowledge, skills, and attitudes of a competent osteopathic physician. Accept the responsibility only for those matters for which I am competent. Maintain the professionalism and trust expected of an osteopathic physician. And never take advantage of the doctor-patient relationship. Show compassion and respect for all others. Set worthy examples in the application of humanistic principles. In my relationships with patients and others within the medical community. Work toward improving my sensitivity and skills in human interaction. Understanding and respecting the differences among my patients and colleagues. Value the knowledge and wisdom of the physicians who have preceded me in the profession. Recognize my and endeavor to contribute to the osteopathic tradition. Recognize my weaknesses and strengths. And strive to develop those qualities that will earn the respect of my patients, my colleagues, my family, and myself. Continue learning throughout all the days of my life. Congratulations, class of 2024, again. On behalf of President Lawler, Provost Bilski, and the Board of Trustees, faculty, and staff, thank you for joining Pacific Northwest University of Health Sciences and the College of Osteopathic Medicine class of 2024 for this special event. The ceremony is now concluded. Please remain seated for the processional.